Hi everyone, welcome to my channel. I'm Aaron who's working in Australia and I'm here to share my knowledge that I gained during my journey from nursing student to RN. So this video is mainly about simple medication error in nursing. So you might be thinking, what is simple medication error? Because you might have heard that common medication error, but I'm writing it as simple medication error because this is the simple error that you do while administering medication, but which might get unnoticed because sometimes this error might not make a huge impact on patient and no one might notice that they have done that mistake. But of course, sometime this simple medication error also might affect patient and have great adverse effect. So I just wanted to aware you about these simple things that you need to keep in mind while giving medication. So let's start. So first thing is expiry date. So I want to ask whoever is watching this video, how many people who is watching this video check expiry date before giving medication? Ask yourself and be true to yourself. As we know, when we work like every day in the hospital, we look after same patient, we'll be giving same medication and we'll think, it's same medication. So we already checked the expiry date. So why to check today? But what if the medication has been changed in another shift? Like someone might take that packet and later replace with another packet. That might happen and you're coming next day. So you might not know what might have happened in other shift and you might just give that medication and later you might realize that it has expired. Or let me share my experience. So when I was a nursing student and when I was giving a medication and I was following 5 rights of medication and showing it to nurse that I'm following those 5 rights, and when I did like right meds, right patient, right time, then when I went to expiry date to tell nurse, I realized that the medication is expired and I was literally shocked, and it was very good learning experience for me because during my nursing student initial journey I used to think like, how will there be any expired medication in such a big hospital? I felt like there would be someone looking after it and just keep on changing. I thought that medication, like we just keep on giving medication, so there is less chance of medication that gets expired. But you might not believe you'll find medication expired much more than you might think that there will be. So please check expiry date before you give any medication. Don't make this error. And the next thing, check medication name not in the box. So this is also the thing that I learned during my nursing student journey. So what happened similarly, one time when I was checking medication, I was doing the 5 rights and I was taking the medication with the MAR in the, not in the medication, with the medication box, like main box. So when I checked, it was right. Date was right, expiry date was right, strength was right. And I just opened the box, I took out the medication and I was about to pop it out. And I realized the name in the medication uh, leaflet is different. So it was different medication than that I was checking with the nurse, and I showed her, and I was shocked. And that day I realized that we shouldn't check in medication box. So let's give an example. So there might be a box of atorvastatin 20 mg, but some of the other nurse while was administering medication, they might have popped atorvastatin 40 mg in the box of atorvastatin 20 mg. And if you just check with the outer box and give that medication, what happens? You'll be giving 40 mg of atorvastatin instead of 20 mg. So this kind of errors can happen. So please keep an eye on those things and don't check medication from the outer box. check with medication itself, please. Next thing, I realize, of course, if it's S4 SS, you'll be checking with other persons, so you'll check whether it's slow release or not, whether it's modified release or immediate release, when it's expiring. But when you give the normal regular medication, that's not locked and that doesn't need other person to check, then there's some higher chance of making mistakes. Similarly, in terms of like slow release and immediate release, there are some of the medication apart from S4 acid, which is separated as slow release and immediate release. Let's give as example as metformin. So we have two types of metformin. One is slow release and one is normal one. So what happened is, like, I just realized myself. So when you check medication, okay, you'll check metformin and you'll check with the medication, and then it's metformin. Oh, it's metformin, I'll give it. But you'll have two kinds of metformin. One is slow release, one is immediate. Even if you check the strength, like metformin 50 mg, metformin 50 mg, just giving you as an example. But so that's right. Basically, you're checking the strength, you're checking the name, you're checking the expiry date, but the thing, you didn't check full name. So you might be giving metformin slow release instead of the normal one, and that of course will have impact on patient, because that's not what we are intending to give to patient. So make sure you check these things apart from just checking their main name. And other thing is, there are, so what I realized during my nursing journey when I started working in the hospital, that there are some medication that is charted as regular and as PRN, and especially it's more about, let's say, about pain relief medication, that you can see, like, for example, you can see paracetamol as regular medication and paracetamol as PRN medication. So you know how much is the maximum dose you can give it to a patient, even if it's there is as PRN and regular. So sometimes they might chart regular medication, suppose 2000 mg like BD, but they might have charted PRN paracetamol, so which you can give it every 4 hours. But you might not calculate when you give the PRN dose that the total amount of dose might exceed the normal dose that should be given to patient. So let's say the maximum dose you can give it to any adult is 4000 to 5000, but you might not check it with the regular and PRN, and you might end up giving them 6000 mg. So make sure you know what are the PRN medications listed for that patient and whether that's in the regular medication. It's not only about the same medication. There are some medication, like you might give lots of, like you might give now the regular analgesia and then PRN analgesia, and then after some time again you might give them a lot and oversedate them, which might have adverse effect on patient. So keep an eye on those things as well. And next thing is a hydrocortisone cream. So this thing I got to realize from the senior nurses, like they told me, because there were so many patients that were on hydrocortisone cream for different reasons, and they told me, like, this is the cream, you just apply little bit, just rub it, don't apply it as a normal cream like a normal moisturizer or something. Even if there is a lot of area that you need to cover, just take a small bit and rub it all around. Don't put like a thick layer or a lot, just take a small amount. It's different than moisturizer or any other cream. This might have negative effect on your skin if you apply too much. So that's also a tip. And the last one, mixed medication. So you might be wondering, what's mixed medication? So if you have noticed, there are some medication that is mixture of two ingredients. So sometimes you'll find, let's say, Piptas. So it's a mixture of piperacillin and tazobactam, and you'll find the different dose of both, and you need to see both dose. So what happens, you might, like in our regular when we are giving medication. So I'll explain with the example. Triazole Ellipta is one of the buffer. So it has 3 ingredients, that is flutic acid furet, unmeclidinium bromide, and bilanterol. So these 3 ingredients makes one buffer. So if you see, we can find two kind of strength of this medication. That is, first one, that is 100 of flutic acid furet, 62.5 of unmeclidinium bromide, and 25 of bilanterol. And next is same, but the flutic acid furet is 200. So this makes the difference. But sometimes you might just check the name and you think, like, you read it 100, 62.5, 25, and they have charted 200. So why not give two buffer? But what happens? Of course, flutic acid furet is doubled, it's fine, but the other two ingredients also gets doubled. But you didn't want those ingredients to be doubled, because if you see in the order, it was 262.5, 25. But if you give 2 times 2 puff of 162.5, 25, then you'll be giving 200, 125, and 50 of those 3 ingredients. That's not what we are intending to give. So make sure if there is any medication that's mixed of 2 or 3 ingredients, make sure you check the dose of everything before you give it to them, because these are the simple things that you might make mistake but can eventually have adverse effects to patients. Sometimes it might get unnoticed, but of course you won't be lucky, or patient won't be lucky every time you make this kind of mistakes, and that won't have negative impact on patient. So please, while you give your medication, follow 5 rights of medication, that is right person, right dose, right medication, right time, and right route. At the end, please do like and subscribe my channel for more nursing videos. Thank you for today.